I'm James Thurmond, a neurosurgeon at Lancaster NeuroScience Spine Associates. I began my education at Rose-Hulman Institute of Technology as a chemical engineer. That progressed to biomedical engineering as a master's degree. I subsequently went to Indiana University for my medical education and stayed there for my first year of internship. Following internship at Indiana University, I went to Newark, New Jersey at the University of Medicine and Dentistry and completed my neurosurgical residency training program, in addition to a fellowship in endovascular neurosurgery to treat aneurysms and AVMs. Following my neurosurgical training, I arrived here at Lancaster NeuroScience Spine Associates. The decision to come to Lancaster to practice neurosurgery was really one that my wife and I arrived at together. She's from Havertown, Pennsylvania, which is an hour away, so we wanted to be close to her family. But we interviewed throughout the country, and I think one of the things that really led me here was the practice itself. It's a large group, it has a great reputation, and each of the neurosurgeons here truly care about their patients, and that was a huge draw for me. The medical community here in Lancaster is wonderful. That was one of the leading drives for my wife and I to come here. She's a family physician, and she had to feel comfortable with the community we were joining as well. And I think we both found that everybody has been quite welcoming, and to have all areas of medicine covered and covered thoroughly, from internal medicine to OBGYN to neurosurgery, it's a great diversity to have in Lancaster. And my wife and I are very pleased with the decisions we've both made in coming here. I chose to be a physician after my father got sick. It wasn't any profound event, but he had asbestosis and emphysema, which led me to consider becoming a physician. But because my undergraduate training was in engineering, chemical engineering, and that progressed to biomedical engineering, it kind of pushed me towards a more mechanically inclined subspecialty, such as orthopedics and neurosurgery. When I entered my clerkships and training, I just fell in love with all aspects of neurosurgery, from brain tumors and AVMs and aneurysms to reconstructive spine surgery. And I just knew that from that point on, that's what I wanted to do. My area of specialty here at Lancaster NeuroScience Spine Associates is vascular, including aneurysms and AVMs, carotid endarterectomies, but it also includes spine. I have a focus upon minimally invasive spine, including complex spine for reconstructive surgery. Additionally, due to my endovascular training, I have an interest in treating aneurysms, arteriovenous malformations, and also carotid endarterectomies. The most rewarding part of my job is seeing patients postoperatively. I enjoy seeing them in follow-up and hearing their story, how they've improved and gone about the rest of their lives. Their activity levels increase, their pain levels have decreased, the use of pain medications has also decreased. It's very rewarding to hear that you've contributed to making some patients' lives better. My philosophy in treating patients is to be conservative. I think that each patient deserves a chance to get better on their own without surgical intervention. That includes trying all conservative measures from physical therapy, pain medications, anti-inflammatories, before jumping to the final conclusive definitive intervention of surgery. If you don't give a patient that chance, that opportunity to get better, then you could be doing a surgery that is otherwise not necessary. For patients who continue to have back pain, then physical therapy is the next most logical step. Physical therapy for range of motion, stretching, and strengthening exercises is a very key element in the recovery process. As for interests outside of neurosurgery, of course, my family. I also enjoy running, soccer, and aviation, which I've not begun yet, but soon hope to do so.